Hello, I'm Kate. I'm a veterinary nurse and PHS Direct Advisor. It can often be difficult to tell if your pet is showing symptoms of illness. What I'd like to do now is to show you how to do some of these simple checks at home. This is Hebe. As you can see, she looks fit and healthy at the moment, but we're going to do a few checks just to double check that. We're going to start at a head end and do what they call the top to toe. So we're going to be looking at her head and going right the way through to her toes as we check her. Let's take a look at Hebe's eyes and her gums, okay? But I think now I'm actually going to call in a helper just to help me steady her a little bit so that she doesn't jump around too much. Hello, Hebe. Right, okay. So if we take Hebe and we have a look at her face, okay, can we see any signs of any swelling at all? On her face, the answer to that question is no. What we're going to do now is we're going to bring down her eyelid and just see if we can actually have a look at her eye colour underneath. So we're looking at the actual lower eyelid, as you can probably see just there. Have a look in her mouth now. So we're looking at her gums. As you can see, they're nice and pink there. Now to check the circulation, we're going to use our thumb or a finger and actually just push onto the gums until they turn white and then release. As you can see, they went nice and pink again. I'll just do that again so you can see. They should be less than 2 seconds between the time it goes from white back to pink again. That indicates a normal circulation. If it's any longer than that or it's prolonged, then you're looking that the circulation may be compromised, and that really does need to have attention. As you can see, her tongue's nice and pink there. That also is a very good sign, indicating good health. Hebe's panting at the moment. You can see that her chest wall here is moving in and out. That is normal. What we're looking for is that it's moving in and out rhythmically and there's no problems there. What we don't want to see is that her abdomen or her tummy area here is actually moving in and out quite a lot. If we notice that that's moving in and out, then it can mean that, that the animal's trying to breathe really, really hard and they're finding it difficult to do that. Also, we want to make sure that that area itself doesn't feel hard, it doesn't feel like a drum, or it doesn't feel like this fluid inside. If obviously we're noticing that, then that needs veterinary attention. When we have a listen for the breathing, we want to hear normal breathing, which would be sort of like a gentle whooshing sound. If you put your ear to the chest wall of the dog, you'll be able to hear that quite clearly. So if I do that, you can hear it sort of going in and out. What you also can do is you can actually have a listen to the head end as well. If you put your face near her nose, you'll be able to hear her breathing there. Sometimes, if you're noticing there's sort of audible wheezes or crackling or anything like that, try and find out exactly where it's coming from. It may be coming from the nose or it may be coming from the chest. Either way, it's really important to try and assess where it's coming from. As you can see, she's sitting here in her normal position for breathing. What we don't want to have happen is for her to start leaning over and really trying to gasp for breath. That position would be normal and would require veterinary attention. I've brought my helper back in just to help steady Hebe while we have a look at her body. This is an important part. I know it's disgusting, but we need to have a look really to make sure, because it will help assess her overall health. What you want to do is you want to lift the tail, okay, and you want to have a look at her glands. What we want to make sure is that there aren't any anal glands which sit either side of her bottom. They're not protruding in any way. Or if there's any sign of any poo, you want to note what colour it is, if there's any nasty nifs that are coming from that end. When I say nasty nifs, what I mean is any putrid smells, any fishy smells, or anything that you're noticing isn't normal for your dog, then really that would need further investigation. See if you can see first, if as I say, if there is any discharge there, make a note and then perhaps mention that to your vet when you do take your dog. Okay, what we want to do now is we want to check your dog's consciousness, okay? Hebe's conscious at the moment, but if she wasn't, she may be sort of lying down in a deep sleep, in which case what we can do is we can check around the eyes to see whether we're getting any reflexes there. All we do is just take a finger and literally touch around the eyes. If you're noticing she's actually blinking, there you go. We want to check the pedal reflex now. So again, what we want to do is we want to part the toes to get to that bit of web skin in between the toes. If we pinch that gently, as you notice, Hebe's actually pulling her foot away. That's quite normal. I hope these few simple tests will really help you and your pet. It's worth remembering them because you never know when you may need them. We at PHS are here to help you. If you are worried about your pet, give us a call.